amount of stuff to get you up to speed on, and obviously we'll go through this as fast as we can. We'll take questions afterward. I think tomorrow we're at a different time. Alex, what time tomorrow? Can you come back to me? Ask Mahan. We've got a call with the White House tomorrow, which conflicts with our normal time. So we're going to be a little bit earlier. I think we're going at noon. 12 o'clock tomorrow, so it'll be right here. The only issue with that will be, and I'll speak for Judy, you may not have all your data as buttoned down as you would like by noon. It takes Judy and her team a good amount of the morning, in fact all the morning, to get to where she wants, so we can be as accurate as possible. And again, I'm honored to be joined by my partner in government, as always, Lieutenant Governor Sheila Oliver. Sheila, great to be with you. Commissioner of the Department of Human Services, Carol Johnson. We're going to hear from her. To her left, at least answering questions, if not jumping in on any number of topics, Superintendent Colonel Pat Callahan. To my right, as I said, she no longer needs any introduction, the Commissioner of Health, Judy Person-Kelly. To her right, a new face, at least as it relates to these conferences that have involved me, Dr. Ed Lifshitz, Medical Director, Communicable Disease Services inside the Department of Health. Dr. Lifshitz, it's great to have you here. And Assistant Commissioner, the guy we're familiar with, Chris Newworth, the Director of the Department of Homeland Security was here, Jared Maples, and our Head of Emergency Services in our offices, Dan Kelly, among others, are with us today. We received 162 new positive test results. 2 cases, if I get this wrong, Judy will correct me, 2 cases that were reported yesterday in which were under further investigation turned out both to be out-of-state residents. So they are now being removed from our count, and our statewide total is now 427. So this is increasing with a pretty steep curve, as we had expected. And again, you've got a combination of a couple of things that we have already previewed. Number one, you've got some amount of community interaction and spread as part of this, and importantly, a lot more people are getting tested. And I'm happy to say that as of this Friday, there will be another big opportunity for folks to get tested, and Judy will get into the details of that. Sadly, we have learned overnight of 2 additional deaths related to cases of COVID-19. That brings the total fatalities of the 427 positive cases. That includes 5 fatalities. Again, Judy will get into the details, at least as a top line. We're not going to get into a whole lot of detail, but she'll get into the detail of all the positive tests, including by county. I want to reinforce the announcement made earlier today that our statewide 211 call system is now up and running as an additional resource for residents. Residents can also text NJ.COVID to 898-211, 898-211 to receive text information and stay informed. Or if they need live assistance, they can text their zip code to 898-211, 898-211. And we thank the United Ways of New Jersey for partnering with us on this. As Judy invariably or I have said at these gatherings, as a general matter, if you've got questions about this, it's 1-800-222-1222, and the website is NJ.gov/health. Also, in a number of things, in direct response to the letter that I sent President Trump yesterday, in fact, we got an initial email reply Dan Kelly got last night, I think at around 11 o'clock. I had a conversation this morning with the U.S. Army Corps of Engineers in the person of Major General Jeff Milhorn and his team. General Milhorn will be coming here to Trenton tomorrow for a meeting with me and my team to see how the Corps can help us build out plans for expanding New Jersey's hospital capacity. Judy could give you a little bit of a sense of what that looks like. Pat Callahan and Dan Kelly have each been up to their eyeballs in that. Again, I thank the Trump administration for their swift response to our request. It has been and will continue to be a busy day. In addition to speaking with the Army Corps, we had a very constructive call with our congressional delegation from both sides of the aisle. We went through what the reality of the coronavirus was in New Jersey, which obviously they know, but we went into detail, steps we've taken, help that we still need from the federal government, in particular in terms of equipment and things like the Army Corps, FEMA, which has been very involved with us this week, and also the likely financial impact. I don't have a number for you, but you can't do what we have done and not have a dramatic, and I would use the word dramatic, impact on not just people's lives, we're seeing that for sure, but also on the health of the state's budget and on the state's revenues. So we talked with the congressional delegation about things like getting flexible block grants as fast and as soon as possible. That is the singular, fastest and best way for us to shore up our finances. Grants and forgivable loans, which are modeled after the Sandy Essential Services grants and or community disaster loans, again, which Dan Kelly ran. CDBG or other programs to fund loans and grants in addition to the proposed SBA program. Operating subsidy funds for bus and rail transit. You can imagine the impact that this is having on NJ Transit as it is on the MTA in New York, etc. And then lastly, but just as importantly, real relief at the individual level, particularly for those who are struggling and who need help the most. Things like lowering eligibility thresholds for SNAP or food stamps and free and reduced price lunch student benefits to ensure that more people can access the programs, as well as more flexibility to when the benefits are received to reduce pressure to go to grocery stores and reimbursement for emergency child grants. I could go on, but the block grants are number one in terms of what we need to shore up our finances. Again, an excellent call. The delegation has been extraordinary on both sides of the aisle. One example, earlier today, Congressman Donald Payne and I spoke. He serves on the Homeland Security and Preparedness Committee in the House. He chairs the subcommittee which oversees FEMA activities. FEMA Region 2 has been working hand in glove with Colonel Callahan and his people to set up some testing sites, among other things. The Congressman and the Colonel had a great conversation which will bear fruit. Judy and I and others will also be on a call later today, a combination of CEOs of big healthcare systems on the one hand and union representatives of our healthcare workers on the other hand, to try to iron out some of the challenges inevitably that we're going to be facing with something of this scale. You know, getting more consistency across the healthcare systems, making sure there's consistency in things like training, obviously personal protective equipment, daycare. How can we redeploy folks from other walks of life into help, etc. And I am additionally having a call with representatives of the educator community to walk through the reality of the coronavirus situation in the state, how we got to the decision we got to in terms of closing schools, and where we see the road headed. So lots going on. I want to reiterate that and you all know this, but I want to repeat it, that all events of 50 or more persons are canceled as a matter of protecting public health. I've ordered this not just for some, but for all events, and that includes a concern I have, and I can speak on behalf of Pat and law enforcement up and down the state. We don't want events to go underground into people's homes. If people are gathering in large numbers, we don't care where they're gathering. It's a public health concern, and we will enforce this aggressively over the coming days and weeks if need be. We need everyone to take personal responsibility to do their part to flatten the curve. Again, a lot of what you're going to continue to hear about over here, aggressive, proactive, tough measures to flatten that curve. You could see by today's positive tests, we're not there yet by a long shot, which will over here lessen the burden on the healthcare system and hopefully save lives and keep more people healthy. But you're also going to see us over here, we can't rely on this for sure. We can't rely on exactly when that curve flattens. So over here, you're going to see us, Judy, Pat, and others, going out aggressively trying to build out our capacity to care for people. Simply put, this is not a time for anyone to be bringing people together. whether it be for a wedding, a funeral, per John's question yesterday, a religious rite of passage, a large birthday, an anniversary, or other party. My team got on me kind of hard yesterday after I said I wouldn't break up funerals. I still don't know what would break up a funeral, but the fact of the matter is we mean it when we say 50 people. You're going to have to, and I feel awful about this, you're going to have to figure that out. We mean it. It's a real public health reality. Anywhere a group gathers is a place where coronavirus easily spreads. Even if you're showing no signs of the illness, this is, again, a particular shout out to our youth. You could still carry and spread coronavirus. We cannot run the risk, especially where there may be multiple generations of people gathering or even interactions with older generations. I take personal responsibility for the public health and safety of our state. And if you or your great aunt are unhappy about this, I am sorry. I feel badly, but for your safety and hers, it is my highest priority. And we know this could be a delicate and hard decision for families. We appreciate that. As I've said all along, there's anxiety, and we understand it. We respect it. Our job is to be straight with you, to do everything we can to get out ahead of this, and by doing so, even though there's short-term pain, to lessen the anxiety and not to increase it. But these are extraordinary circumstances, and we cannot continue either with the concept of business as usual or equally out of sight, out of mind. As I've said all along, this is no time to panic, but it's just as much no time for business as usual. So we urge you, in the strongest possible terms, make the right call. If not for you, then for your families and friends, and help prevent the spread of coronavirus and help flatten the curve. I want to spend a good part of my remarks on the human and social services responses we are engaged in, and I'm going to ask Commissioner Johnson to speak to this in greater detail in a minute. There are many communities across our state who rely upon the Department of Human Services and their direct care provider partners for daily life. Many of these residents are considered especially vulnerable to coronavirus. It is imperative that we do not disconnect them from their lifelines during this emergency. To be clear, we consider home health aides and other direct support professionals to be an essential part of our emergency response team. They are first responders within our healthcare system for many in these communities, and we thank them from the bottom of our hearts. We need these folks working and caring for high-risk seniors who live alone, or helping individuals with developmental disabilities, many of whom may face other very real health and safety issues. When I say we're going to get through this as one family, I mean it. We are going to get through this. I say that unequivocally. But we cannot leave anyone alone at this time of heightened anxiety. Carol and the department are also doing all they can to ensure that the families of those working on our front lines, our nurses and hospital personnel, lab technicians, and other frontline public health workers, our law enforcement and fire professionals and EMTs, our corrections officers, the women and men working in our supermarkets, among so many others, that all of them are able to continue to access the critical child care services they need. Let me say it this way. We need everyone who is part of our frontline army to be able to get to work so we can beat back the threat of coronavirus together. And in this, child care professionals are themselves essential players. As Carol will lay out in greater detail, we're taking extraordinary steps to support those who need these services and these critical service providers, whether that be extending emergency financial support for families in our subsidy program who are relying on child care during this emergency, ensuring providers in our child care subsidy program are paid if they close, or providing greater access to cleaning and sanitizing supplies. We must ensure a continuity of child care for our frontline public health and response workers. Now, the department doesn't do all of this on its own. We know another critical social service support network exists within our many varied communities of faith. We have been communicating daily with our faith communities to help us get our message out. Additionally, the Interfaith Advisory Council, which is convened and chaired by Homeland Security Director Jared Maples, has kept open the lines of communication within our communities of faith. In fact, you have a call on for tomorrow morning at what time? 11 a.m. And there are, I might add, in the Interfaith Advisory Council over 3,500 members. And my guess is you'll get good attendance given what we're dealing with right now. First, I want to thank our faith community for embracing fully the need for social distancing. And I appreciate that social distancing is, in fact, the opposite of what many of our faiths teach. Our faith leaders recognize that their paramount role is to protect their communities. They live that reality every day, pandemic or not. We know that canceling a service or closing a sanctuary entirely is not an easy call, but in these times, it is the right call. And may I say this as clearly as possible, several very dear friends among the faith leadership community have come to me over the past 24 hours. We need all walks of our life, and in this case especially our faith leaders, to adhere to the 50-person maximum requirement in terms of gathering. We must get 100% compliance in our faith communities and around the state. And because of these actions, we know that many of our houses of worship at the same time are facing very real challenges. And we pledge to work with them to seek out creative ways to mitigate their pain and ensure their long-term health. But more than ever, we need them to keep spreading the faith. We need them to stay active in our communities and help us disseminate vital information. And we need them to rally our communities to send up their prayers to lift up our state's spirits. Sheila's heard me say this before. I'm in way over my pay grade here, but I know they've certainly lifted my spirits, and I live every day with my favorite scripture in my heart, 2 Timothy chapter 1, verse 7, "For God hath not given us a spirit of fear, but of power and of love and of a sound mind." And as I close my comments today, I ask every New Jerseyan of every faith, or those of no faith, to embrace these words. This is an anxious time. We have said that. We understand the anxiety. We respect it. Who could blame you? Our job is to be straight with you, to do everything we can to proactively get out in front of this, to beat down this curve over here and over here to expand our capacity to deal with this crisis. For the most part, with our healthcare workers, bless them, our heroes, we'll take the lead over here. We need the 9 million New Jerseyans to take the lead over here. We need you to live this. Everything from washing your hands with soap and water, to social distancing, to sneezing and coughing into your arm, from not touching your face. If you don't feel well, stay home. No gatherings over 50, and don't go underground. Moms and dads, I'm asking you explicitly to make sure your kids are not having big house parties. And I promise you we're going to be policing that. When we say stay off the roads between 8 p.m. and 5 a.m., we mean it, just for essential folks to be out there. So for all of the above, the 9 million of us will flatten the curve over here. Our extraordinary leadership in partnership with our federal partners and our extraordinary healthcare workers will do everything we can over here. I'll conclude by reminding folks what I've said the past couple of days. The overwhelming amount of folks in this state get it. They've got their anxieties, but they understand what's before us and what they have to do. We don't have many left, but there still are folks who are non-believers. Believe this. Trust us. And again, if we get this wrong, it's on yours truly. And we won't, in the sense that this is real. And then lastly, particularly, I can't say this enough, to our young folks, you may feel like you're above it all. You may feel, and you are, the picture of health. But if you gather, you run the risk that you spread it from one to the other. And by the way, you could get sick. And more importantly, when you sit with grandma or grandpa or an older relative, mom, dad, teacher, coach, you could be unwittingly spreading the virus. So to those who have anxiety, our job is to lower it. To those who don't yet believe, and I don't think there are many left, believe, trust us. And to those who have not heretofore cared, care, please, for your own sake and for the sake of the rest of us. God bless you all. With that, it is my honor to introduce, to say a few words, my partner in government, the Lieutenant Governor of the great state of New Jersey, Sheila Oliver.
Thank you, Governor Murphy. I was so pleased that the governor is working with the congressional delegation to seek block grants. Block grants allow us the opportunity to invest resources where they're needed without regulatory restraint. One of the things that many of the administrators in our departments are talking about, many of us are currently the recipients of federal assistance to do a variety of things. And I think no one more than Commissioner Carol Johnson can attest to that. We have existing funding from the federal government, but we're hampered and hand-tied by regulation. So we are going to begin to outreach to the regional administrators of the various federal departments to see if we can work towards waivers to give us flexibility to use those funds other than a very specific defined population. One of the things that people always lament about, well, yes, there's government help, but I'm never eligible for it. We want to broaden the universe of New Jerseyans who are eligible for those things. So, Governor, I am so pleased that you're having that conversation with the delegation. Also, just want to touch on Jared and the faith leaders. And one of the things I am hearing from faith leaders is that because they're not having mass, because they're not having services, of course, their revenue is declining as well. So in the next several weeks, I think we'll be working internally in the administration. New Jerseyans are the most charitable people to be found, and I hope that we can set up some methods in which we can call upon the citizens and the residents of our state to provide support to those faith institutions. And then I'll conclude by saying that I'm going to give you a website, a correct website. I would like you to encourage your readers and your viewers to go online to NJ.gov/DCA/DC AID. Right on that website, you can apply for the full menu of services that you could potentially be eligible for. It'll take you 3 minutes on the website, and we can make a determination. I want you to know that it is anonymous and it is confidential. Thank you, Governor.
Thank you, Sheila, for not only those words, but for your extraordinary leadership, both as Lieutenant Governor and head of the Department of Community Affairs, which is one of the biggest parts of our government. So I'd love to ask Commissioner Persicelli to comment as she does every day, and I cannot say enough about the extraordinary work that she is doing, and I hear from all over the state, as well as your extraordinary team. Comment on what we've seen overnight. You know, as you can see, folks, the numbers are, as we predicted, going up. Give you some more color on that. Also, how the healthcare system is holding up, Judy, and anything you've got in particular on testing. Welcome.
Sure. Thank you, Governor.
Commissioner of the Department of Health, Judy Persicelli.
Good afternoon. Yesterday, we received about 670 calls on our hotline. That's a total of over 8,600 calls. So as the governor said, we're concerned that your calls are answered in a timely fashion, that you're not held waiting. So to ensure that you get the information that you need, we've expanded the call center to include the New Jersey call center 211. As cases continue to increase in the state, our concern about the healthcare system's capacity also grows. We talked a little bit about that yesterday. As the governor and I have mentioned, we're looking to ensure that hospitals have the manpower, the supplies, and the space to care for residents. There are predictions that many parts of the United States will have far too few hospital beds if the new coronavirus continues to spread. That's why we're looking with our hospitals to develop surge and capacity planning. Right now, we have identified additional capacity that can be rapidly brought online. 260 additional beds can be brought online and will be prepared today. 199 are in the north, 11 are in the central region, and 50 are in the south. Additionally, we expect 227 more beds to come online within the next 3 to 4 weeks. We recently, yesterday, completed a walkthrough at Underwood Memorial Hospital in Woodbury, New Jersey. We are working with the board and administration at Inspira Health, and I want to thank them for this, and we expect that that hospital can reopen and accommodate an additional 300 beds. This facility would be a general acute care hospital to absorb the surge we're all expecting. As you know, all hospitals in New Jersey are able to and are expected to care for COVID-19 patients. To meet the need for additional healthcare personnel in the state, we are working with the New Jersey State Nurses Association. Judy Schmidt, the CEO, has put out an alert to all nurses that hold an active or inactive license in the state for a call to action. I will be connecting with her on Friday at the end of the week for the responses and the follow-up. Additionally, I signed an executive directive yesterday that would authorize hospitals to use New Jersey certified mobile intensive care paramedics in their hospital settings to perform function and duties within their scope of practice to enhance and supplement the existing medical and nursing staff. We're also working to protect residents in healthcare facilities in our state. As you know, last Friday, we sent guidance to all long-term care facilities to restrict visitors in order to protect this vulnerable population. The only exception is for end-of-life situations. This includes nursing homes, assisted living, pediatric long-term care facilities, and dementia care facilities. I cannot emphasize enough how important it is to protect these vulnerable individuals. They are most at risk, as we have learned from the outbreak in Washington State. At the department, we are monitoring all outbreaks of respiratory illnesses, and that's defined as 2 or more individuals in a facility with symptoms, no matter the cause. We are looking at them in all of our long-term care facilities to be alert for any problems. We also restricted visitors to Department of Health licensed substance use disorder and mental health programs. As we mentioned previously, we are working to expand testing in our state. The Bergen testing site will be up and running on Friday. Initially, it will collect specimens for symptomatic individuals. We will be prioritizing our symptomatic healthcare workers first and our first responders. This site will have the capacity to collect 2,500 specimens a week. As you can imagine, as we find more positive cases, the work for our local health departments greatly increases. Every day they work tirelessly, boots on the ground, to investigate cases, identify contacts, and take the appropriate public health actions. To support their important efforts, the department has been working with Perry Halkitis, the dean of the Rutgers School of Public Health, to connect his students with local health departments. I'm pleased to say that those individuals will be redeployed next week, and they will provide the extra resources to carry out this vital work to protect public health. As I mentioned previously, New Jersey has been expecting the return of 9 asymptomatic New Jersey residents from the Grand Princess cruise ship. These individuals are being held under CDC quarantine at the Dobbins Reserve Air Base in Marietta, Georgia. We expect 6 of these individuals who are identified as low risk to return home today and to self-quarantine for the remainder of their stay, about 4 or 5 days. Now I will provide you with an overview of new positive cases. We are sad to report today 2 additional fatalities of individuals who have tested positive for COVID-19. As we have seen across the nation and in New Jersey, both of these individuals were high risk, over 60 years of age, with comorbid conditions. Of course, our thoughts and prayers are with their families. Today we're announcing 162 new cases for a total of 427 cases. To center our thinking around this, our first case in New Jersey was March 4th. On the 16th, we reported 80 new cases. On the 17th, yesterday, we reported 89. Today, we're reporting 162. Here is the breakdown by county for the cases for the counties we have information on, and these numbers are not complete. Atlantic, 3. Bergen, 27. Burlington, 5. Camden, 5. Essex, 12. Hudson, 9. Hunterdon, 2. Mercer, 6. Middlesex, 17. Monmouth, 8. Morris, 9. Ocean, 4. Passaic, 8. Somerset, 8. Union, 12. And we have 27 that still need a county assigned. We're still gathering those details. The age range for the total positive cases is 5 years to 95 years of age. I know this is a difficult time for all of New Jersey. As the governor has said repeatedly, we will get through this together. All of you can do your part to lessen the spread. Follow the governor's social distancing measures. Please stay at home when you're sick. And practice respiratory etiquette. Wash your hands frequently during the day for 20 seconds with soap and water. And practice general good health hygiene overall. Take care of yourselves and your loved ones. Thank you.
Thank you, Judy, again for extraordinary leadership. I think if you do the math in this, there is a chunk of unknowns to be determined. But if you've been listening the past couple of days and you'll do the math, 18 of the 21 counties now have a positive, at least 18, I should say, because there's about 30 unknowns at the moment. The exceptions right now being Cape May, Salem, and Sussex. And so, as Judy predicted, when it was only a handful of counties, this is a statewide reality, clearly much more intense in certain counties like Bergen than in others. So as we've said many times, so thank you, Judy, thank you to your team. As we've said many times, in government it takes a village, both folks within government, across the range of government agencies and departments. And again, we started studying and trying to figure out how to react to the coronavirus in January. We established our whole of government task force on February 2nd or 3rd. Here we are on March 18th at every step of the way trying to stay out ahead of this thing, and obviously it is a beast no matter how you slice it. But one of the most important departments alongside health is the Department of Human Services, and with that I'd love to ask Commissioner Carol Johnson to say a few words about what her department is up to help us fight this battle. Thank you, Carol.
Thank you, Governor Murphy, Lieutenant Governor Oliver, Commissioner Persicelli, Colonel Callahan, for your leadership during this difficult time. In Human Services, we're actively working with the frontline health and social services workforce to support the response. Our priorities are the health and safety of the individuals we serve, the health and safety of our workforce, and the health and safety of the workforce of our critical partners and communities across the state. First, through Medicaid's long-term care program and our Division on Aging, we help to support seniors across our state who are homebound, or those who are now homebound because their congregate site is closed and have limited natural community supports. That means the home health aides, private duty nurses, and our county-led aging network are a critical workforce that is caring for our older, vulnerable residents, in addition to in nursing homes, but as importantly, in their homes across the state. We're working to support older residents and their care providers in maintaining these services and working with our community partners, including by mobilizing the nurse care managers of our Medicaid health plans to do proactive outreach to all of our higher risk seniors and identify critical needs like medication, medical supplies, and food. We're working with our county offices on aging to help them maintain food for their Meals on Wheels program and other senior feeding programs. We're also working with them on outreach to seniors who are known to be socially isolated. We are also in close touch with the home health aide and personal care provider community to identify issues, and we had a large call with them yesterday morning, and we're continuing to move as quickly as possible to address issues they raise. We're very focused on rides to critical medical appointments that are provided by our Medicaid transportation provider or from programs through our county offices on aging. We're working hard to continue to secure rides to necessary medical appointments and very focused on what we consider life-sustaining services like dialysis, chemotherapy, and methadone treatment. We're not alone in this work. We're closely coordinating through the Emergency Operations Center the governor stood up and working closely with Colonel Callahan and General Beal and others to make sure local emergency management is tracking these critical needs for our community-based high-risk older residents. Second, as the governor mentioned, we're doing our part to support the critical child care needs of those who need to work in this difficult time and who serve or could serve, who are served or could be served through our state's child care subsidy program. We're taking action to help families in need of child care and those centers that are able to remain open by, one, waiving co-pays in our state child care subsidy program if parents are unable to pay because of COVID-19. We're providing enhanced payments to providers who are able to remain open at this time and serve our child care subsidy children. We're providing an enhanced payment of $100 per child in subsidy per month to help support those child care providers. We are going to pay in our subsidy program based on enrollment, not attendance, so that those providers get the money that they need, even if a child who normally would show up is not there. We're continuing to pay subsidies to those centers that are forced to close so that at some time we can hopefully bring them back online and that they don't lose their business in the short term because our subsidy isn't available. We're creating flexibility in our subsidy program rules so that it's easier for eligible parents and parents who might newly become eligible because of changes in their job circumstance to enroll their children in our child care services. Child care providers who are able to serve critical needs at this challenging time are doing very important work. We're grateful to them every day for the work they do, but never more than in this challenging time. Third, there are the vital services that we provide to adults with developmental disabilities who live in the community with support from direct support professionals and those with developmental disabilities who live at home with support from their family or other professionals. We're grateful to direct support professionals who are working both in the community and in our developmental center facilities who support this critical population. We've taken several steps here, including temporarily suspending congregate day programs for individuals with intellectual and developmental disabilities. We're providing flexibility to families who are able to employ workers directly through our programs to allow them to hire additional workers quickly to support their loved ones as needed. We're also working through our care manager partners to check in with and identify needs for those with physical disabilities who participate in our personal care assistance program and in other programs across the department. Fourth on our list, we're laser focused on the needs of individuals with mental health and substance use disorder and the network of residential and community-based providers who serve them. We issued guidance yesterday to our methadone clinics, which provide both methadone and buprenorphine to individuals with opioid use disorders. Methadone has a very specific federal rules that govern how it's prescribed. We've worked with our federal partners to create some flexibility here for our clinics so that individuals might be able to take more medication home where clinically appropriate so that we can reduce the volume in these facilities and the amount of travel that individuals have to do to get methadone treatment. Buprenorphine does not have these same restrictions, and we are working closely with our Medicaid Centers of Excellence on opioid treatment to make sure we're doing everything we can to sustain individuals who are in treatment throughout this emergency. And make no mistake, this is a challenging time for all, but it's very challenging in particular for those who we serve with mental health and substance use disorders. And we're working very closely with our community provider network to hotspot issues and support their needs so that these critical services can continue. Fifth, I want to talk briefly about the individuals and families in our state who are lower income and depend on our programs for supports, and those who are at risk for or are homeless. We are in close contact with our partners across the state who are the lifeline of supports for this vital network. We hosted 100-person calls with both the Pantry and Food Network community, and we had a call with more than 100 providers this morning who provide homeless shelter services and other vital providers across the state. We are continuing to support them in a variety of ways. We've changed many of our rules to make it easier for people to get and keep public benefits. We've extended benefits in both WorkFirst New Jersey, our cash assistance program, for 60 days for anyone whose case was coming up for renewal in March or April so that they don't have to take action to renew their case. We're extending all of our emergency assistance cases through at least April 30th. We're viewing this emergency as a good cause exemption to the work requirements in the WorkFirst New Jersey program and SNAP, our food assistance program, and we're suspending all adverse actions for anyone for noncompliance, including suspending sanctions. We're continuing to work with the homeless shelter community and are working on the needs that they may have for cleaning supplies, and we're talking with them about how they can implement guidance that has come from both the CDC and HUD with respect to continuing to deliver their services. We in the Department of Human Services will continue to take all available actions that we can with the authority that we have and the waiver of that authority under the governor's executive order. We also are expecting additional authority under the legislation that's pending in Congress that will give us access to additional federal waivers to help expand some of our services, and we're working on that now to be prepared as soon as that legislation were to pass. We thank you from the bottom of our hearts to the providers in the community, to the community organizations in the community, to the volunteer organizations and the faith community that is standing up during this critical time to continue to serve the vulnerable populations who have critical needs and are going to continue to have critical needs in the days ahead. Thank you.
Thank you, Carol. And cannot thank you enough for your leadership on this and across the board. A couple of very quick items. I'm looking at Nikita. We're going to have something to say on elections tomorrow, so I can maybe save you or David's question on that front. I meant to say that up front. Secondly, we don't have any announcements today in terms of further social distancing steps, such as we did yesterday with indoor malls, but just know that we're continuing to look and monitor what we've got in front of us. For instance, Patton, a lot of his colleagues were out last night trying to sort of spot check the state, and we still feel there are a couple of holes in the system, so we're looking at that. And thirdly, while there's no particular action associated with this, as I sit here, we are in tense discussions, not just with the federal government, with the White House. I had a good conversation with the Vice President yesterday afternoon. I mentioned we sent a letter in late yesterday afternoon regarding the Army Corps, and Dan got a response last night, and we were on the phone this morning, so that's a good thing. Other areas, I have no news to report on PPE, personal protective equipment, but that's something which is still a significant ask that we have. But in addition to our relationship with the federal government and the congressional delegation, cannot say enough good things about them on both sides of the aisle, just their passion, intensity, what do you need for us to do? Some of the best fighters in the country in Congress happen to represent New Jersey. That's a good thing at a time like this. But also to say that we are in constant discussion with a group of other states as well. And I'd say high on that list are New York, Pennsylvania, and Connecticut. They're not the only ones, but we are constantly thinking through where our commonalities are, and there are many. And if we can combine forces and ask for X or Y, we will be stronger in that ask if we can do it together. I don't want to cut anyone off, but before we take questions, Pat, Ed, Chris, anything any of you want to add? Okay, please feel free to jump in on any of the questions before us. You good, Judy? Okay, let's take a few questions, please. Brett?
Quick three things. One, hotels, they still okay to operate as they are? Two, what area of the state, what county has the most need for hospital beds? And three, the second testing site in Homedale. Do we know when that will be online?
First, hotels are still open for business, Pat, to the best of my knowledge. Although Pat's an important guy because based on the executive order that Sheila and I put forward, it gives Pat complete latitude to add or delete entities from that list. So as if we're walking down here, hotels are still okay. I'll let Judy answer both the second and third question, but I would just say Homedale, we hope a matter of days within Bergen opening on Friday. Judy.
In the Northeast, it's going to follow. It's just going to follow the spread of the disease. But we do anticipate that it's going to be a statewide issue before long.
And would you agree that Homedale is, or Pat or Judy, within a matter of days after Bergen opens? Chris?
Yes, we're working to have the Monmouth County site up and running by next week.
We're all looking at each other to make sure we agree with our answer. May I just say, I don't know if Judy said total cases. You said how many overnight, but total cases to date by county, top four, Bergen 113. This is the denominator is 427. Secondly is Essex at 45. I know, for instance, Essex, Congressman Payne, the county executive, they would like to try to figure a way to work with Pat and FEMA and Department of Health to get a drive-through. That's going to be a little bit more off. Middlesex has 40 cases, and my home county and Monmouth have 32. Those are the top four. Please.
This is a question for Commissioner Judy on testing.
Sorry, again, I apologize. I meant to say Alex has got the mic again with the off-white ivory-colored glove, and the reason for that is for our streaming services. It doesn't do anything for amplification in this room. Forgive me for not saying that already. Please.
So, how many different kinds of COVID-19 tests are being used? Do we know? It seems like different medical groups and organizations are adding them almost every day now. You've got FEMA coming in with their tests. You've got another drive-through test in Secaucus. Somebody else is opening one. Is anybody keeping track of this? Do they have to get FDA approval? Do we know, are there problems in terms of reliability for these tests, false negatives or positives? Could this skew our overall picture of what's going on here? And are there any suggestions for people in terms of where they should or should not go to get tested?
Let's let Judy answer, and or Chris. Chris, do you want to jump in?
So thank you for those questions. I think the point of clarification is that these sites are specimen collection sites. These are locations where individuals who are symptomatic can present, go through the process, have a nasal swab specimen collected, and then those specimens at the end of that operation are brought to one of the commercial laboratories for processing. So the process for specimen collection is basically standardized throughout the state, and then depending on where the clinic is operating, they'll send their specimens to a particular lab like Quest, LabCorp, BioReference.
So what about the tests themselves?
The tests, same tests.
That's what he's referring to. It's collection on the front end, of which there are a number of different places you can go. The most robust as of Friday will be the one, I think, in Bergen County College. But the back end, there's a limited number of folks who actually perform the test. There's the Department of Health. There are a couple of hospital systems. And there are, I think, 3 private sector test, high scale, by the way, which is important, high volume testing companies. Is that fair?
Dr. Lifshitz would be able to.
Yes. Hold on one sec. Ed.
And just quickly, so the testing that's being done on all these is all using the same general procedure. They're all using what's known as a PCR test that looks for the virus itself. These tests are all need to be approved through the FDA before, you just can't go out there and say, hey, I want to run this test. So that's what's happening on the other side.
Like last week, Hackensack Meridian announced some breakthrough where they had a test that could get results in hours and not days. Now we haven't heard about that. Is that being used? Are other companies doing this? Is it reliable?
It's absolutely being used, right?
It's absolutely being used.
Yeah.
And you have to recall that, Hackensack in particular and others, Those are not the high throughput clinical diagnostic laboratories that LabCorp and Quest are.
This is an important point. Chris, what's their capacity daily, would
Theirs
you
is
say?
more or less equivalent to what the state lab can do, between 40 and 60 or so. Whereas the high throughput clinical diagnostic laboratories can be in the thousands.
So the same test, just quicker.
Essentially. Let's keep moving. John.
On the numbers, can you tell us how many people Sorry. On the numbers, can you tell us how many people who are positively or presumptive positive and infected have been hospitalized and are currently hospitalized? And can you talk about the numbers of hospital beds that are currently being occupied? In other words, you talk about the possibility of shortages down the road. What's the percentage right now of people in hospital beds? And on the numbers, how many people have been hospitalized because of this? And have any of those hospitalizations or positive cases come from nursing facilities and long-term care?
All good questions that I don't have answers for. We do not have the diagnosis in every hospital of a COVID-19 individual. We do know generally about 55% of all of our positive cases end up in the hospital. That's a general number. That will fluctuate depending on the number of cases that we have. We do not have specific hospital-based diagnosis. We are tracking number of individuals that are admitted from nursing homes. I don't have that number today, but I will have it for you. You can ask Alex, and we can get it for you later. We track that very diligently because of the high-risk nature of those individuals.
Judy, has the 55% about held in terms of 55% of positives either are or have been in a hospital?
I would think so, Ed.
Yeah.
Dr. Lifshitz, he's closer to these numbers
Yeah.
than anyone.
And the short answer is yes. However, we expect as time goes on, as more and more people get tested who have milder symptoms and milder illness in the first place, that those numbers will drop. You have to remember that early on we've been testing mostly people who have been the sickest to begin with. So that doesn't mean that 55% of everybody gets sick with this will end up in a hospital.
If that number holds true, John, it looks like about 230 out of 427, assuming that number has held. Let's also remind everybody, and again, if I get this wrong, the health experts will correct me, that we have a lot less visibility into the high-speed, high-scale commercial testing companies. BioReference, Quest, LabCorp. The good news is they could do a lot faster and a lot bigger scale, and we need that. The challenging news is we don't have at least at this point the same insights as we would have in particular into the Department of Health. And I also want to underscore something that Ed just said. When the first tests were available, particularly obviously at the Department of Health, you were by definition testing people who were, I'm going to use a term of art here, quite sick. We are not yet going to be to the worried well. You're still going to need a permission slip essentially to pull up to Bergen County College on Friday. You're going to have a healthcare counterpart that's going to deem that you're worthy of that test. But by definition, the pool is going to be more healthy and less acute than the original pool that we started with. Is that a fair assessment?
Friday, we're hoping to test symptomatic individuals who have a primary care physician. However, if they do not have a primary care physician and they are symptomatic, there'll be a screening, they are symptomatic, we will develop a feedback loop to make sure that every single person that gets tested knows the result within a certain period of time. I can't tell you specifically what that period of time will be. We're obviously working on that, but I want to make sure that individuals understand that they will not be turned away if they do not have a primary care physician.
Judy, I assume tomorrow that we'll have some of the protocols for Bergen County ready to go live with you all so you can hear it, and we'll disseminate that out through all of our social media and other channels. Okay, folks, please.
Question about the economic impact that this is going to have. We've spoken with a number of small business owners who say that this will cost them a lot of their workforce or put them under altogether. Will there be any state aid available for small businesses, or has the SBA given any indication if they might declare a disaster, SBA loans?
So several things. Dan Kelly can correct me if I'm wrong on the SBA front. We've put our request in. We're waiting to hear back. And any more color you'd add to that? Yeah, we're checking that real time. So, listen, the impact on small businesses is unmistakable. When you shut restaurants and bars in a state our size, and you go takeout only. I'll give you an anecdote. Last night, my family and I we're living through this like everybody else. First two restaurants we called up to order in from were closed. So this is real. I mentioned this at the outset. This is going to have an enormous impact on the finances of our state. We're not immune. I mean, we're not alone in that respect. We are one of 50 where the impact is going to be significant on individuals and workers and all the things that Carol, for instance, enumerated for so many of the folks that her agency deals with. But also unemployment insurance, their working lives, period. Secretary of the Treasury for the federal government last night said that he could see the unemployment rate approaching 20%. That's double what it was in the Great Recession. Small businesses you've referred to, large businesses certainly aren't immune in our state finances. So as I said, if at the end of our call with the congressional delegation, I said the two words we all need you to remember more than any other right now are block grants. The extent to which, and Sheila was extremely good on this, the extent to which we can get block grants, we can continue reaching deep into our communities and helping the folks who need it the most. So thank you for that. Charlie.
Do you at this stage consider the president to be a reliable or partner with the state right now? I mean, there's been a lot reported about his sort of early mismanagement of the crisis, his dismissive tone, and some of even inaccurate claims about testing and the like. I was just wondering, do you think he gets it now?
I'll leave history to the historians, and I have less interaction with the president than I do with the vice president and their teams. The president and we were on a call on Monday. His rhetoric appears to be, at least in the past 24 to 48 hours, consistent with the challenge that we have before us. But it is the vice president that we spend, Secretary of Health and Human Services, and their teams respectively. And I would just repeat, and it's worth repeating, the asks that we've had. We're persistent, and we'll continue to be forward-leaning on those asks. The most acute challenge we have is with personal protective equipment. I know Chris Neuwirth has ordered 1 million N95s. The problem is, and he's doing extraordinary work, that could be 5 or 6 weeks away. So we got a fraction of our ask. We need more from the strategic stockpile. We've asked for boots on the ground. FEMA Region 2 has been very, very good this week. This is since Monday they've been at it. I can't say enough good things about how quickly the Army Corps turned around. By the way, that was out of a letter that I wrote the president, in fairness. So in that case, I give him credit, and it's too early to determine, but we've spent a lot of time speaking with the administration as well as our delegation on the financial. The question was asked a minute ago. We're going to need an enormous amount of federal help. I'm speaking as much as a former banker, not specific to New Jersey's needs, but the national. I think the national appropriate level of stimulus is something, believe it or not, in the $3 to $4 trillion range for national stimulus. And New Jersey will quite happily take our fair share. Alex, I think Charlie has a follow-on here.
This is a separate but coronavirus related. Yep. Do you think it's appropriate for the Highway Authority to be even considering a toll hike amid this period, especially when the community and the journalistic focus on this is severely constrained right now?
I don't know that I've got a strongly held opinion. I believe that there are a couple of public hearings today. I mentioned this, I think, yesterday. So I don't have a whole lot of visibility into it, but I did ask that two things be considered. And I know I spoke to one of them, which is that they be live streamed, and please God, they will be. And secondly, which I may or may not have mentioned yesterday, I strongly urge that the comment period be extended, given what we're going through. And I believe, Mahan, that has happened. Is that correct in both fronts? Yes. All right, thank you. Who else has not asked? Nick?
I have two things for you. So, are you prepared at this point to say that candidates, staff, and volunteers on political campaigns from both parties should stop all in-person voting or all in-person voter contact? And then, are you involved still with the DGA while this crisis is going on in any way?
Yeah, I'm not sure that I'm prepared to say. Was it to say to any campaign no human-to-human interaction? Well, there's not a lot of it going on, so we've already limited interactions to 50 people of any kind, and then within that, there's got to be social distancing. I can't recall the last time I saw an actual political event happening. You may know better than I. It's been weeks, I think. There's not a lot going on, so I'm not sure. I'm prepared to say what we've said as a general matter: no more than 50. Keep your social distancing. Mind your P's and Q's. And it ought to be essential, whatever it is. I saw Vice President Biden last night, for instance, speaking on a live stream, I think from his house. Is that right? Yeah, in Wilmington. And secondly, on the DGA, very much involved, but all of it by telephone, and much more sort of technical matters of late. This is consuming more than 24 hours of my day right now. Thank you. Elise.
Two questions. The first, has the number of unemployment benefit applications exceeded what was filed on Monday?
Not have an answer for that, Alex. Assuming we have it, we'll get that back to you. I don't know the answer. On Monday, yeah. No, Monday was 15,000. You're asking if it has exceeded that since then?
Yes.
I don't know unless you. Yeah, we can get that for you.
Okay. And for the Colonel, I'm familiar with two weddings in Lakewood that were shut down by local officials because the attendance was so great. Are you familiar with any other incidents around the state that in which law enforcement told people that they had to clear out?
I am not, Elise, and I wasn't even familiar with the ones in Lakewood, honestly. But we actually have our Regional Operations Intelligence Center trying to monitor all that. I'm on the phone every day with Chief Chris Lusner, who's the president of the State Association of Chiefs of Police. So we're trying to just see what is, from what we're gathering the last few days, people have been complying. But to the governor's point, if they start not or we find otherwise, we will take action.
He's in the back.
Yeah, hi. Could you give a status report on schools? I assume they're all now closed. Any particular challenges that have emerged in these first days?
I asked this. Dr. Repillette, as you won't be surprised, has been manning his post over the past couple of days to make sure that things were going well. We had a sidebar again an hour or two ago with Sheila and Pat and myself. I think we think things are good, but I do think there's at least one story we heard that troubled all of us, which is the meals. Again, the concerns we had were food access for kids who don't get a good, reliable hot meal anywhere else other than school, remote learning, and daycare. And I think food every time out was number one on my list. And we heard a disturbing story that the food was prepared and very few of the lunches or meals were picked up. And I think it's fair to say Sheila was quite concerned about that. I was as well. I think, Pat, we're trying to get to the bottom of that. Is that right?
I did follow up with the Commissioner Repillette on that, and that's not that we're not looking into it further, but he said that's normal on a lot of times, that the food is prepared and that doesn't get out. So we're looking into whether it's other distribution points, whether it is the privacy concerns, if we have the ability to deliver meals, are we able to give out addresses of students? So it's almost an hourly conversation to make sure that we don't fail in that regard.
And is that in multiple districts, or was that an isolated here or there
issue.
That was in one district that we heard this morning.
It was one district, but it was a big number, and it concerned Sheila and me. I know it's concerned Pat and the rest of us as well. If we're going to go to the trouble of making the meals, and we know for sure that there are literally tens of thousands, in fact, I think it's a couple of 100,000 in total, kids in this state where their only place they're going to get that reliable meal is in a school, we better darn well be able to deliver the bacon. No
And then
pun intended.
Just one
Please.
more. At least one state and a couple others are considering closing schools for the rest of the school year. Is that even on the table at this point? Do you want to speak to that?
I can say unequivocally, and I literally mean this, everything's on the table, but no decisions have been made. Folks who have not yet asked, so we'll do 1, 2, 3 if we can, please. You have asked, so everyone else who has wanted to ask has asked, so we'll go back for round 2.
Okay. We've talked a lot about testing and positive cases and how this is expanding and so forth. Has there been any discussion about trying to quantify recovery? Exactly what does it mean if we say a certain percentage of people are recovered? At what point? How long does that take? Once they recover, are they completely recovered? There were some stories from China where they had celebrations and then 2 days later the guy got tested positive again. Do we have enough information about this virus to be able to say when it's considered quote unquote safe to be considered recovered and when somebody could go and, for instance, check on an elderly relative?
Ed, do you want to get that?
Neither of us want to answer it because the answer is not really. I mean, we're learning more about this virus every day. The CDC in particular is doing those sorts of studies, both on the earlier people who came into the United States and so forth. There are people being swabbed regularly every single day. So we're learning more about it all the time. We have some good general ideas, but if you ask me those sorts of specifics, my answer is no, we can't tell you. Well, the general is like many other viruses in this family or other things. We know about what the incubation period is. We know about when you begin becoming infectious. We know that there is the ability for this virus to spread before you become sick, but we still think that when you're sick is when you're spreading it the most because it's when you're sickest. We know that after you recover and you feel well, you may still continue to test positive for this virus. It's less clear exactly what that means if you test positive for this virus going forward as to whether that's what's known as viable virus, meaning whether it actually can infect other people or not. And certainly we think that you're less infectious. But if you ask me for a hard cutoff where I can say absolutely for sure when anybody can stop being infectious or when I can be sure that they would not again become ill, the answer is no, I can't tell you that.
Thank you, John. Sorry. Thank you, Alex.
Yesterday's action with the executive order telling locals and counties to comply generally with the state order. Are you going back at the executive order in Bergen, and any thoughts on Hoboken Mayor's order to shelter in space for that city?
So I'll leave the specifics aside, but we're looking at each one of these. Sheila and I take each one of these steps seriously. Again, I'll repeat what I said yesterday. I haven't found one person whose heart's not in the right place, but at the end of the day, the buck stops with us, and we reserve the right to overrule, reverse, whatever it takes. I would only say this. We spoke to Mayor Bala and his team last night. That is a recommendation from him in Hoboken. So that's not a hard and fast executive order, and it's hard to argue with someone making a recommendation. We believe we are seeing the whole waterfront of the state, no pun intended, and that we are, we're not patting ourselves on the back, and we're not saying we're the smartest folks in the room, but we think we have the most amount of information on which to make decisions like that. But a recommendation, it's hard to argue with unless we have a violent disagreement with it. And as it relates to other local or county executive orders, we'll take them as they come. But at the end of the day, again, I want to be unequivocal. The buck stops with us. We reserve the right to either confirm or deny any orders that are out there. Nikita, then we'll go back to you, Brett. Alex, thank you again for your help.
So this kind of got brought up earlier, but I was wondering, do you agree with the bailouts proposed at the federal level, and do you agree with the limits that Senator Warren wants on those bailouts? And then are there any state-level bailouts planned, like cutting gate fees for airlines at Newark?
So I don't really have a comment per se about bailouts. I actually don't even know what Senator Warren's plan or proposal but I will say this, I don't know what form it takes other than it better take block grants. It better be one of the forms. But the amount of stimulus that we are going to need as a country and as a state is a big number. And so my only advice is history will not be unkind to our country if we overshoot. History will be very unkind to our country and to our state if we undershoot. So whatever is at our disposal, and there's no amount of money in any state, New Jersey, New York, California, you name it, there's no amount of money that can deal with the challenges, the economic challenges that will come from this. The federal government, Congress, the administration. And again, there's good news here. There's a lot of feeling to me like there's a lot of bipartisan coming together, but the numbers are going to need to be very substantial. Brett?
Do we unless I missed it, do we have a county-by-county breakdown of how many cases there are total now?
We do.
Can we get?
Can we get that? Can Alex get that to you afterwards?
Sure.
Is that all right?
Okay. Yeah, that's fine. No, I just want to make sure.
Again, I just want to reiterate, I did say earlier the top four are Bergen. Again, if you disagree, Judy, tell me. Bergen 113, Essex 45, Middlesex 40, Monmouth 32 are the top four. They sort of. Oh, sorry, I skipped Hudson. Hudson 34, Monmouth 32. Those are the top five, and we'll get the rest of the list to you. Please. Sorry, I apologize. Were you up? I didn't see you. It's okay. We'll go to the back, and then we'll come back down to Elise. Thank you.
Any further progress? I think you mentioned yesterday about converting dormitory beds or using them for isolation.
No, but in the interest of time, if they disagree, jump in. But that's one of the things we're talking. Not only are these folks, Judy and Pat, looking at that, but that's on the list of projects that we want to talk to the Army Corps about as well. Elise, is that fair, folks?
For the commissioner, the recent beds that you have identified, were they in wings of hospitals, or where did they come from?
Primarily in hospitals that have wings that have been closed because utilization has gone down. So they have medical gases. They're appropriate to open up, and we're pleased that we have that capacity.
May I say this? And Judy, if I get this wrong, please correct me. We've looked at a lot of things. I was asked about dormitories. I also think about pop-up potential that I know that we've utilized in the past via the State Police OEM. It's worth noting, and if I get this wrong, again, I'll be corrected, that some of this also is displacing current patients who are under healthcare supervision for a reason other than COVID-19. Is that fair to say?
To handle the surge is going to come in two directions. One is going to be the COVID-19 patients, and then the other patients that come into the hospital through the emergency room that are appropriate for an acute care stay, and perhaps a bed is not available. And that's where opening up a closed hospital, using an empty nursing home that has the facilities that we need to adequately take care of that level of patient is going to become really important.
In fairness, a dorm is more likely to be in a quarantining capacity for someone who's got either low-level symptomatic or asymptomatic we want to isolate. Fair to say. Please, and then we'll come back to you, Charlie.
Question along the similar topic. Are there any other specific sites that you are considering for surge capacity other than Underwood? And I know I've asked this before, but just to get an updated number, what's the current number of beds in New Jersey that are available?
I don't have those statistics with me today. I answered it yesterday for the absolute number of beds.
Alex can get you that because we have gone on record with those. Is that all right, Judy?
Yes.
Afterward?
And it has stuck with me that we have 2,000, almost 2,000 critical care beds. For what I know, for what's going on in hospitals, it's those critical care beds that are so important. And I know we have just about 2,000 of them. And total number of beds in, somebody's handing me statistics. So we have 16,433 med-surg beds and 1,983 critical care, about 2,000.
Rough only by 17. Other hospitals that you're looking at other than Underwood?
We actually,
Or facilities, yeah.
Well, we actually looked at every closed hospital in the last 10 years, and most of them were not able to be brought online. Underwood, being the most recent, was able to be brought online. We're also looking at empty nursing homes. We're looking at spaces that are under construction that can be outfitted with medical gases and the appropriate ward type of a facility. So we're just about looking, like the governor says, everything's on the table.
Charlie, you had something.
A real quick question about the 2 fatalities. Can you give some more information about them, where they were from, and whether they had exposure to others, or I mean,
I
that
don't
you
have
were
the
able to
second
identify?
question. I can tell you one was from Essex and one was from Hudson County.
Ages or
Both females, Essex and Hudson, both over 60 years of age, both having underlying medical comorbids, but I don't have a list of what they are. This is the general information that I was just given before we came in here.
Do you have the town names or anything?
No, just the counties, Essex and Hudson.
Anybody else before we? So I want to thank, before I thank my colleagues, a couple of things. We've promised, I think, at least 2 things for tomorrow. First of all, to remind everybody, I think we're at noon tomorrow, unless you hear otherwise, Alex. And Mahan is still here. You're saying noon right here? Again, on behalf of Judy and her colleagues, forgive us that by doing it at noon cuts into the time that they need to have the full soup to nuts. We're doing it because the vice president has convened. I'm not sure the president will be on it or not, but I'll probably know when I see you tomorrow, a VTC that we at least a portion of us will need to be on. We've promised 2 things for tomorrow. One is the details regarding the Bergen County drive-through testing, which will open on Friday, God willing, and we'll give folks explicit guidance as to what you need to do to qualify to go to that testing site. I say testing. We're using that word over that reception site where you're going to give your swab, and then it will be tested on the back end. And then secondly, we will have our guidance as it relates, at least in part, I'm not sure in full, but at least in part, on elections. And we'll obviously have the, as best we can at that point, the overnight realities of what we're dealing with. Again, I wrote down a line which I think is the order before us. There is no greater call than to do something bigger than oneself. And that's what we're talking about right now. I can't emphasize that enough. This is the job over here of flattening the curve, getting out ahead of this thing, breaking the back of this is the job of all 9 million of us. We'll do our part. We need everyone to do their part. The healthcare system is going to be in the hands of the professionals, the extraordinary heroes among our healthcare workers, and folks like the Army Corps of Engineers, the National Guard, the state police, and others, in the sense of we're going to flatten the curve over here, but we're not going to take any chances over here, and make sure that we've got the equipment and the capacity that we need. And we're going to get through this together unequivocally, assuming we all do our part. There is no question we will get through this together. We'll be stronger than ever before, not without mistake, not without being scathed, but we will get through this. On behalf of the Lieutenant Governor, Commissioner Johnson, Colonel Callahan, and Judy and Ed and Chris and their extraordinary team at the Department of Health, God bless you all. We'll see you tomorrow. See you, Judy. Sheila, see you.